Implantation bleeding occurs in about a third of all women. And today we're here to break down the difference between implantation bleeding versus your period bleeding. So implantation bleeding occurs when an egg is fertilized by a sperm to create an embryo, and that embryo travels and implants into the uterine lining, which is called our endometrium, to form hopefully a viable pregnancy. And what happens sometimes during that implantation process is that some women experience a little bit of bleeding, but that's not the same as getting your period flow. Your period is when you do not get pregnant and your whole uterine lining sheds. So we're going to talk about the timing, the flow, and the color so that you can know the difference. So the first thing is timing. Implantation bleeding usually occurs around 6 to 12 days after ovulation occurs, and your period happens usually for most women on 14 days post ovulation. And then when it comes to the color, you want to look for, in implantation bleeding, you're going to have that pinkish color or even a dark red. And then with your period, you're going to have a really bright red color. Some women might in the beginning have a little bit of that dark blood. And dark blood is really just, it's old, it's not necessarily a bad thing. And then in terms of consistency with implantation bleeding, you're going to have more a spotting effect, and your period is going to have more of that full flow, sort of a heavy bleed. Those are the top signs to know the difference between implantation bleeding versus your period. Just remember that implantation bleeding, if you do get it, it is not a bad sign. So if you see a little bit of blood when you're going through an IVF cycle after a transfer, or if you're trying to get pregnant via IUI or naturally, it's not necessarily a bad thing. It could just mean that that embryo is implanting and hopefully you're getting pregnant.